first of all, do you brush before or after breakfast?
I probably shouldn't say this on camera. Dr. Rhona Eskander is a dynamic and innovative dentist.
Your lifestyle affects your teeth. 95% of dental diseases are actually preventable, and people don't know that.
She's CEO of the Chelsea Dental Clinic in London.
Alcoholic mouthwashes are actually extremely dangerous. What people don't realise is that tea causes a lot of staining more than coffee.
And when she's not transforming smiles, she's regularly posting educational content and busting the dental health myths on social media, as well as regularly featuring on TV.
Vaping is such a topic, right?
Have you seen an increase in the amount of people engaging with cosmetic dentistry?
Now, I have to be completely honest with you.
Hello everyone, and welcome back to Vision of Health, the podcast where I talk to qualified experts about what being healthy really looks like in everyday life. I'm Dr. Frankie Jackson-Spence. I'm a medical doctor specialising in cancer research. My mission is to bridge the gap between science and real life, offering you practical advice to help you improve your lifestyle that is actually backed by the evidence. I'm Dr. Frankie, and this is my Vision of Health. The gut microbiome has gained huge media attention recently for its links to our wider health. But what's often overlooked is that the mouth is the gateway to our digestive tract and is home to its own microbiome. Our next guest is here to change the way you think about your teeth and your oral health like never before. Dr. Rhona Eskander is a dynamic and innovative dentist. She's CEO of the Chelsea Dental Clinic in London. Welcome to Vision of Health.
Thank you so much. What an introduction. Thank you.
You're such an impressive human, and I am so excited for this conversation.
Oh, you really are.
Oh, very kind. I'm going to jump straight into the juice because you have got so much knowledge about dentistry and oral health and so much we can learn from you. I think when it comes to kind of our teeth and dental health, everyone pretty much knows that they need to keep their teeth healthy to stop them dropping out and to keep them white and pearly. But there's so much more than that when it comes to our oral health. How is our oral health linked to our general health?
So I'm so glad that you asked these questions, because I think that dentistry has been that part of medicine that's been really overlooked. It was like, you've got the medics that are doing all these amazing things, and dentistry is like the people that didn't get into medical school, which couldn't be far from the truth, you know? And, you know, you've always got these jokes, especially from The Hangover, where they're like, is there a doctor in the house? And then the dentist puts his hands up and he's like, no, a real doctor, you know? You've got this. But actually, in a way, dentistry is a specialty if you think about it, and we're specialising in the teeth and the mouth. And as you said, it is the gateway to the gut. The oral microbiome is now being researched more than ever, and it has such a strong link to the rest of the body. So what we are discovering, we've known for a while that the bacteria in your mouth is directly linked to systemic diseases. I'm sure you know that, for example, there's a bidirectional relationship with diseases, with gum disease, periodontal disease, and also diabetes. So if you have diabetes, you're more likely to have gum disease and vice versa. So actually treating the diseases in your mouth is going to have an impact on your whole body. And we're also finding that there's links now between the mouth and dementia, the mouth and sexual dysfunction, the mouth and, you know, heart disease. There's all of these different things. So it's really, really important that we look into how cleaning the mouth, treating diseases can impact the whole body.
I think that's fascinating, because when we're taught from a young age to brush our teeth, it's mainly for a cosmetic reason, isn't it? It's to be like, so your teeth don't fall out, to keep them white.
Yeah.
And we're not really educated on how much it could actually influence our risk factor for developing those diseases.
I think so, but I think also, Frankie, you know as well that like we're so bad at prevention in this country, and dentistry is, you know, it's a national crisis at the moment. You know, the NHS can't cope, waiting lists are up to 5 years, people are pulling out their own teeth at home, children can't be alleviated from pain. It's really sad, you know, it's almost like, how did we get to this state? But we've never put an onus on prevention. We're really good at putting out the fire. So when people are, you know, at that state where they can't cope anymore, yeah, fine, we'll put it out. But we need to really understand why people got there in the first place. And 95% of dental diseases are actually preventable, and people don't know that. And it's not that you have to invest a lot of time and money on preventing those diseases. It's about people being equipped with the skills to prevent those diseases.
Wow, that's fascinating. So what kind of skills and things can people do to keep their mouth and oral cavity healthy?
Okay, so there's a lot of like myths that people aren't aware of. Like, first of all, do you brush before or after breakfast?
I do it before breakfast.
Good.
Because I was told that the acid from what I was eating
Correct.
would make my enamel soft.
Correct. So people often think if I brush after breakfast, it's better for me because I'm brushing away breakfast foods. But breakfast foods are very acidic. So for example, orange juice, cereals, etc. So what it does is that when you eat them or drink these drinks, the pH in your mouth gets a lot lower and it provides the optimal environment for bacteria to thrive. So you're more likely to get cavities. Now, if we brush before breakfast, what happens is that we provide protection from the toothpaste. Also, like the fluoride, for example, can protect your teeth and enamel. However, if you insist on brushing after breakfast, you should wait at least 20 to 30 minutes because then you've got the pH in the mouth has time to neutralize. And when it's neutralized, it's much easier and then you can brush if you want to. So that's one thing that you can do. Another thing is chewing sugar-free chewing gum between meals with xylitol, because xylitol is actually anti-cariogenic, which means it helps prevent decay and it stimulates your saliva flow, so that helps neutralize the acids in your food. You should also be reducing the frequency of sugar consumption. So it's not necessarily the amount, it's the frequency. So for example, if you buy a chocolate bar and you have little bits throughout the day, it's much worse than if you have it all in one go. And the reason is, again, it's because your mouth will stay in this constant state of acidity and doesn't have time to neutralize. So then the environment is thriving for cavities to form. But if you have it all in one go, you have your acid attack, things neutralize and things go back to normal. Obviously, it's brushing twice a day, every day for 2 minutes. And people don't realize that. Like, if you time yourself,
2 minutes is long.
It's long. Time yourself. I challenge it. And what people don't realize is that it's a long time. But you should also be brushing your gums and your teeth. So we advocate something called the modified Bass technique, which basically involves holding the toothbrush half on the gums and half on the teeth. So people often brush just their teeth, and when they bleed, they get put off and they think, oh, is it like a wound? Is it going to heal itself? But bleeding is actually a sign of gum disease, also known as gingivitis, and you have to scrub your gums until the bleeding stops. So the idea is you keep brushing the gums until the bleeding stops. And I'm not saying, do it so that you cause recession on your gums. You basically do these soft circular motions. So those are some of the things people can do at home. And obviously looking for a toothpaste that has the right ingredients. So ideally you do want something that does have fluoride. Fluoride on a topical level is good for you, and you're looking at least 1,200 parts per million of fluoride on the toothpaste tube, and try to avoid the whitening toothpastes because they're actually quite abrasive, so they can strip away your enamel, making it weaker.
And what about the products in terms of our microbiome? For example, we're taught to use either no products or certain products for our intimate skin. Would different brands of toothpaste or different whitening toothpaste versus regular affect the microbiome differently? Because I've seen some toothpaste brands that claim that they balance that oral microbiome.
So this is really a good one. So now there's dental products out there. Parlor, actually, our mouthwash contains oral probiotics. So in the same way that you would take probiotics for your stomach, the probiotics can help the good bacteria thrive and get rid of the bad bacteria. What's really interesting, actually, though, is mouthwash. So the alcoholic mouthwashes are actually extremely dangerous to your microbiome, and they strip away. It's alcohol, right?
It's like using Dettol in your mouth.
Yeah, exactly. And it's so potent. And actually, we advise, when you go down that supermarket lane and you see all of those multicolored mouthwashes, you got to think to yourself, is that good for me? You wouldn't drink that stuff, right? But you're happy to put it in your mouth. The most absorbent part of your body is the soft tissues in your mouth. And actually, all that alcohol, all that coloring is not good for you. And we don't advocate patients to use it. And, there are mouthwashes that are, specifically designed to help harness, but not those multicolored alcoholic ones. I can tell you that for free.
Love it. Oh, I honestly, for years, I would always use them, thinking I was being, in between, in the middle of the day, a little freshen up. But
well, have you tried? It might freshen your breath for 3 to 5 minutes, and then test your breath after 30 minutes, and you'll see
probably
that.
Worse.
Yeah.
Gosh, God help anyone that was around me when I used to use them. When it comes to our health, one thing that I love about kind of lifestyle behaviors is that often the benefits all overlap. So, for example, if you get a good night's sleep, it not only helps with your mental health or it helps you feel great the next day, but it also helps reduce your risk of disease. And same with exercise. Are there any lifestyle habits that people might be doing anyway for other aspects of their health that are going to positively influence their oral health?
Well, I think certainly like one of the diseases that's really overlooked is bruxism, and bruxism is also known as teeth grinding. And I often see people, specifically like in London in our lifestyle, that grind their teeth and their teeth become shorter, more painful. They've got a plethora of issues that come because of the bruxism. So actually, your lifestyle affects your teeth. Meditation and yoga can help relax the jaw. You can help kind of get into that position. Breath work as well, practicing nasal breathing when understanding.
Really want to talk about this.
Yeah, practicing your nasal breathing can also impact, the structure of your face. But we also know on top of that if you're a mouth breather, you lose a lot more water, and losing a lot more water has dehydration impacts, which could also affect the teeth, etc., and the state of your mouth. But it's like everything that's synced, as well. If you're not exercising, you're tired, and all of these different things, you're going to make poor food choices, and poor food choices is directly related to cavities forming in your mouth.
That's a link I never even thought of, actually, because I know if you're sleep deprived, then you're more likely to pick kind of sugary, carby food the next day.
Correct. And not brush your teeth.
Yeah.
And obviously alcohol as well. Classically people find that their oral hygiene gets a lot worse, during Christmas periods when they go out and drink a lot, and then they come home and then they don't brush their teeth and they've consumed all that alcohol. So
yeah, that's fascinating. I have to say, I think that Invisalign was really good for like ingraining good dental habits for me, because I stopped snacking and I was always brushing my teeth because I was too worried about it. That's
good
great.
Patient.
That's great to know. And are there any habits that people do, you've mentioned drinking, that are bad for our oral health, like vaping?
Vaping is such a topic, right? So one of my colleagues actually talked about vape tongue. So the thing is that vaping hasn't been around for long enough to do, the longitudinal studies that we really need to be doing. But we do know that it is much more harmful than we initially thought it was. Vaping can cause dry mouth, also known as xerostomia. Dry mouth has an implication because that also allows bacteria to thrive. You can get cavities. It can also be contributed to gum disease. Vaping also is persistent heat in your mouth, which can be directly linked to oral cancer. Although there hasn't been an exact association between the two, we can confer. Also, a few of my colleagues have been telling me anecdotally that they have found that their implant failure has increased with vapors. So we know that vaping is going to have a massive effect on the mouth because it's also that constant chemical use that's hitting this small area. So it can't be good for you.
Absolutely. I think, back in the day, my mum was telling me that the doctor used to offer you a cigarette.
Yeah.
We didn't know the health risks.
Yeah.
And it makes me very nervous when it comes to vaping because just because there's no data doesn't mean it's not bad for you.
Yeah.
So it's great that.
And it's just highly addictive, know, and I think, as I said to you, is that people are not recognizing how dependent they come on it. Like something that's highly addictive like that can't be good for you.
I completely agree. I don't want anything else to have control over me.
Yeah.
And for some people, that's like a Diet Coke.
Yeah.
Like they're addicted to that.
That's me.
Really. See, I don't want anything that has control over my choices. Where was I at to? And what about traditional smoking?
So traditional smoking has been proven to have a huge number of negative effects on the mouth. So smoking has been associated with gum disease. So gum disease in its mild form is gingivitis, which is reversible. Normally symptoms manifest as sore bleeding gums. Then if it progresses into a more severe form, it's also known as periodontal disease. Periodontal disease is actually when you start to lose the bone around your teeth, so teeth become loose, you get gum recession, you lose teeth, etc. But obviously the most obvious one is oral cancer. So there is a huge link between smoking and oral cancer. And obviously if you add alcohol into that makes it even worse. And smoking also reduces the success of treatment. So for example, if you get implants, you're more likely to have your implants fail if you're a smoker. If you also have restorations like bonding or veneers, you're going to get staining around it because of the ingredients in the smoking that's going to cause that staining. So there's a number of things, and as you know, it can cause dry mouth as well. And dry mouth is so contributive of things like getting decay. Right,
that's interesting. Just moving on from what you said about staining, So there's obvious food and drink choices that are going to increase staining, coffee being one of them. I am the biggest coffee lover you'll ever meet. Should we be avoiding those things, or can we reverse the staining safely with whitening or whitening toothpaste?
So actually what people don't realise is that tea causes a lot of staining more than coffee. So it's the tannins in the tea. So people that love to like sip like black tea,
as well.
exactly. So that really stains the teeth. Now, there's a number of things that you can do at home. So you can use products that help gently lift the stains. Not all whitening products over the counter are bad, but when you think of whitening, like the traditional whitening you've had, it's based on hydrogen peroxide. Hydrogen peroxide is the key ingredient to cause a chemical reaction from the teeth to go from yellow to white. Now, those products over the counter cannot do that because the percentage that you get at the dentist is 6% hydrogen peroxide or 16% carbon peroxide. Over the counter, it's 0.1%. That's the legal dose. So that's going to have a negligible effect on your teeth. Now, if you have products that can gently remove the stain, so they might have things like like stain removing ingredients, that's fine. So like, for example, with Parla, the toothpaste tabs, we have one called Parla Pro. So we put in gentle stain removing ingredients. That won't harm your teeth. There's other toothpastes on the market as well that can do that. Some of them are hugely abrasive. So it's difficult for you to tell which ones are very abrasive and which ones are less abrasive. And I recommend just asking your dentist because they can look at it and see which one is. The other thing is that you can use devices. So some electric toothbrushes, like I love the Philips Sonic Air, it has a head that basically helps remove the staining from the teeth. And then also the other thing is water flossers. So water flossers, they kind of jet through the teeth and they can help remove staining as well. But obviously if stains are really stubborn, you have to go and see your hygienist and they can help remove it.
And do you think any of these whitening products, whether you get it done professionally or not, have a negative impact on the oral microbiome?
So not necessarily. It's not. Those products wouldn't necessarily have an effect on the oral microbiome. As I said, it's more the alcohol, and you wouldn't really find that in toothpaste.
Okay, perfect. That's good. And you mentioned there about your favourite toothbrush being an electric toothbrush. It blows my mind that people still use a manual toothbrush.
Yeah, I know.
Is there a big difference?
So basically, if you have a manual toothbrush, like there are some great manual toothbrushes, please try and get bamboo ones because single-use plastic is on the rise. So bamboo toothbrushes are what I'd recommend if you want to get it. But really, it's the technique. So you have to practice something called the modified Bass technique. The modified Bass technique is when you angle the toothbrush at a 45-degree angle, half gums, half teeth, and do circular motions for 2 minutes. Most of the population don't spend that long really thinking about their technique or the time. So that's why an electric toothbrush comes in as being better. In terms of if someone's brushing amazing with a manual, that's fine, but most people aren't. They apply too much pressure, not enough technique, for not long enough. And most electric toothbrushes, they've got pressure sensors, they've got timers. So really, it just helps you ensure that you get the job done properly.
I find that I get into a routine. So if I'm missing any spots, I'm probably going to always miss those spots because I do the exact same thing every time.
And if you're right-handed, most dentists will find that a certain part of your mouth is brushed better because of, whether you're right or left-handed.
So how often should we be going to the hygienist or the dentist? Because obviously there's always perfect standards, but people are worried about, first of all, the cost of an appointment, but also fitting it into a busy life.
Yeah.
I try to go every 6 months, but I literally blink and 6 months has come around again.
Yeah.
What would we actually need to go?
So I think it's completely dependent and tailored. There are guidelines given by the NHS on how often people should go, but it really depends on what your situation is. So for example, if you were what we call high caries risk, as in high decay, you need to go more frequently. And that could look like anything from like 2 to 3 months, every 2 to 3 months until you're stabilized. And then we can increase the frequency. If you're somebody that's really amazing, doesn't have cavities, doesn't have gum disease, it could be once a year. But usually the majority of people need biannual appointments to the dentist and hygienist. And now we have hygiene therapists that can basically do your checkup and your clean at the same visit. I have my amazing team that tend to do that. If I have patients, for example, that have had veneers or bonding that's a little bit more high maintenance, I'd like to see them every 4 to 6 months, maybe for like a polish or a check over, because it's important to intervene when needed.
Absolutely. And there's definitely more and more people that are getting things like veneers or composite bonding. Have you seen an increase in the amount of people engaging with cosmetic dentistry over recent years?
Yeah, definitely. I think really there's been a rise in what we call Snapchat dysmorphia, or, you know, like a selfie-itis, because people have become more obsessed with the way that they look. I think that the pandemic was an interesting time for dentists. We called it the Zoom boom because people got obsessed with the way that they looked when speaking, and they were confronted with their images and they were sat at home. So we had a real uptake of people that came in and were like, I need to get my teeth done now. And because we opened the doors after 3 months of being closed, people came in and they were really keen to get started. And I think that a smile has now been recognized as a really important part of not only aesthetic medicine, but also like functional. So people realize that they go hand in hand, because you can't really have nice teeth that aren't functional. You know, and if you have functional teeth, you spend a lot of money getting your teeth fixed so you can eat or you can speak, they should look nice. Do you see what I mean? So they kind of like go hand in hand together. So I think that that's really, really important. And I think that really people now are really seeing as an investment. And I think that's really interesting, especially within the aesthetic field. You know, people are like, okay, I do want my Botox and fillers, but what's the point if my teeth aren't nice? They've recognized the base. And I think there's less of a stigma. If you say you're getting your teeth done, people are quite open about it. But if you say you're getting Botox and filler, people are still a bit like, I don't want to tell anyone.
Yeah, I kind of agree with you there, actually, because no one would bat an eyelid if you said, I'm straightening my teeth. But if you say, like, I'm straightening a wrinkle in my forehead, people have quite, like, big opinions on it. I mean, that's a debate for another time. But I do think it's interesting how kind of into these tweakments and things we have to look great without makeup. It's like this whole looking natural. But it has had some help. What about people that are going abroad to seek out these treatments? Because that's such a big thing. I probably shouldn't say this on camera, but I got asked to go to a European country, won't name names, to go and like represent a clinic and say it was safe.
Yeah. I know the country.
Like, obviously, I'm not going to do that.
There's an animal, a bird, right? That's the country. And so basically, I did a whole...
I obviously didn't go, by the way.
I did a whole documentary on my own. So basically, a couple of years ago, my colleague had sent this video that gone viral of this Irish woman called Amanda. You can look at her story. And what happened is that she went to a clinic and they did all her teeth. I think she paid like 2.5 or 3 grand for all of her teeth. And as soon as then she realized that all the treatment had gone wrong whilst she was out there, but didn't speak the language, couldn't communicate. Well, she had trouble getting back to the UK. She got back, she went to her dentist in Ireland, who basically told her all of the work was like faulty, but it would cost her like £30,000 to fix, and she didn't have the money. And I felt really sorry for her. So I reached out to her and offered her a consultation at the clinic, and it was way beyond my like skill set. So I had to get my team of like 5 specialists involved, and we all decided to basically help her. And she was like our kind of like case study in a sense to show what could happen. And she had to have like root canals done, teeth extracted, gum grafts, everything done. And this took us about a year to treat because the work was so, it would have cost about £50,000 to be honest, just because of like the time, the skill, the materials, etc. And we made a documentary about it, a 3-part documentary, and we filmed the whole journey. And, you know, she's a really, really strong advocate. Now, I have to be completely honest with you. I think it's not black and white, because at the same time, you have people that are like, I can't afford private dentistry in the UK and the NHS have closed the doors on me, so I'm going to fly abroad. Can you blame those people that are in immense pain? So I'm like, there are those group of people that I understand. And for them, if it's affordable and change their life, then I do understand it. And then that's a whole socio-economic conversation. You can't really blame the dentist in the UK because people go, why are the dentists so greedy? Why don't you charge less? But for example, with Amanda's case, there were so many people involved, so much cost, so much material, so much lab fees, you know. When you actually look at it, that is just how much it costs. And it's sort of like, that's the fair price. When people go electively that could have Invisalign and bonding, and they're actually paying a similar amount. So you see 21-year-olds that choose to go abroad instead of doing what you do, as in like just did the Invisalign and the bonding. They paid, what, 3 grand to get a full mouth set of crowns. Now you have to understand that crowns involve cutting the entire surface of your tooth, 360 degrees. You see those peg teeth, I'm sure you've seen those sharp teeth, as people call them. That means they've lost 80 to 90% of their tooth surface. They're only 21. So if the work is done well, they'll have to have it replaced every 10 years. Can they afford to do that? It's unlikely that it will even last that long, because when they've shaved down that much, it will probably snap at snap at the gum line. They're going to end up needing implants and dentures. So people aren't thinking like long term enough. And I really have a problem with the very young people that have very healthy teeth seeking out these elective treatments. People that are desperate and are in pain, I empathise and understand, and that's a different conversation.
So why is it so much cheaper in these countries?
I think, again, you've got to look at the socioeconomic status, right? Like, these are countries that don't have the same, costs that we do, the same implications that we do. And I think when people don't take into consideration, like, look, you are a doctor and you work on the NHS, and, this is a subject that we've got to be very sensitive about, because we're very lucky to have been trained to and done it. And I did 11 years, right, on the NHS, and people say dentists leave because they're greedy. But what people don't understand is you're not just looking like at what the service they're providing. You're paying for like their knowledge, their expertise, their education. Yeah. You're also like so much more, the building they're working in, like the government quotas. There's so much that goes into these costs. And I think people really underestimate it. How the other countries are run, I don't know. But, you're always going to find something cheaper. But having said that, in some of these countries like Turkey, there are some of the best dentists in the world. Do you think they're charging $2,000 for full mouth of crowns? No, because they're not even doing those treatments in the first place. So that's what people really need to consider. It's not about the country. It's really about the treatment that you're getting.
And is there differences in regulation?
Yeah, so unfortunately, like the GDC put up on their website that if you've had treatment abroad, or if even things like not illegal, like unmonitored, like clear aligners, there were brands out there. One recently went bust, where you can buy Invisalign for like £1,500. It's not Invisalign, but it's like, that's the brand, And you never see a dentist, you order them online, things go wrong, company's gone bust, patients are still like in the lurch, but on their website, they're like, oh, and if you've paid by a payment plan, you still have to pay, even though they've gone bust, can you imagine? And unfortunately, because these people aren't monitored and they're not part of our rules and regulations, there's nothing you can do when you're in trouble in the UK. But whether these countries have their own rules and regulations, I don't know, is the answer really. I really don't know.
I think it all comes down to it's a really sensitive debate, especially when it comes for people that really need it. And we're talking about, what you can afford. When it comes to simple things people can do at home, like going to the hygienist, if you budget that in as a preventative thing, it probably will save you money in the long run.
100%.
Because going to the dentist and needing a fix is always more expensive than going and having your twice a year tooth clean.
Yeah. And I think that to be honest, I do think that society really needs to change the way it views healthcare as well. For example, if we all put a little bit of money into the prevention, we'll all be better off. We know as well, like in medicine, like type 2 diabetes, diet and exercise is the easiest medicine that people could have that's also super cheap, to help prevent these diseases. And it's the same, brush your teeth, go to the dentist, eat well. But also we are ignoring the social situation, because not everyone's privileged like we are, and people make choices because of the life that they have.
Yeah, I feel really like on both ends of that spectrum, because my day job is working in cancer clinical trials and I'm treating an established problem and developing drugs. And then my whole other life is this preventative lifestyle, things we can do, to change our behavior and our lifestyle habits on social media. And I think you're absolutely right. I read a stat and it's something like 6 or 9% of the NHS budget is spent on prevention each year. And it's just, prevention is always going to be better than cure. So it's interesting to hear that you think the same issues lie in the dentistry world as well.
And support, because, it's all very well saying, like, for example, if you've got a woman that's living in local authority housing that, has like 8 children or whatever it is, and it's all very well saying eat better and like cook fresh fruit and veg, but if KFC's downstairs and she has a really hard life, that's the thing, like the support and the way that our society is built has to be addressed. It's a huge problem and we can't fix that as individuals. And I think people point the blame at dentists and doctors all the time.
Absolutely. Just then when you were talking about someone going and picking what they're going to eat, I think we know, that sweets are bad for your teeth. And you go to the dentist and they say, oh, you look like you've been eating sweets or drinking fizzy drinks. What about like healthy foods, for example, fruit? Are they equally as bad for your teeth?
Well, I think it's an interesting one because some of the stuff that I see within the dental practice, well, there's two things that I want to talk about. So first of all, yes, another disease that's massively overlooked is erosion. So we've got erosion that comes from two sources. Erosion from the inside. So if you've got an eating disorder like bulimia, or if you've got acid reflux like GERD, the acid hits the teeth and then it can erode the teeth, okay? And so it's not decay per se, it's the acid that's caused that. Then you've got extrinsic sources, so things like Coca-Cola, Lucozade, all of those things. Certain fruits, things like citric fruits, etc., can also cause that erosion. Now, as you said, there's good stuff. So like, I don't want to stop eating oranges or grapefruits or anything like that. So you have to just educate the patient, say like, don't bite straight into it, just cut it up into small pieces. And as I said, like, drink lots of water with it. There's also foods that are good for your teeth as well, like dairy products, so like actually milk, cheese, etc., and all of those can help neutralize any acids. Health enthusiasts take it a little bit too far with like smoothies and like Lucozade and all those sports drinks because they want the energy and they want to kind of live a healthy lifestyle, but that can wreak havoc on your teeth. So it's really important. Things like apple cider vinegar and lemon water, which people love.
We love a detox lemon water.
Yeah, so
what is
all
that
that stuff
doing?
hitting your teeth constantly, all that acid. So I think drink it through a straw. You've got to navigate and manage that, and I think that that's really important. And then obviously, as I said to you, you see people that exercise a lot are underweight, so they're not getting enough nutrients, and you can see that in their mouth. And then obviously a step further is if they have an eating disorder. So bulimia causes a huge number of problems to the teeth.
When you say that someone who exercises too much, you might see that in their mouth. What would you see? How would you know?
Well, not necessarily, but what I mean, if they exercise too much and they don't actually fuel their body, it's the lack of nutrients, for example, and you can just see that, like in different ways. So if they have like a lack of nutrients, you can just see that things just look a little bit unhealthy in their mouth, and they might be more dehydrated, or they might just not be getting. And there's also a link as well between anemia, for example, in the mouth. People might get ulcers and things like that.
I always get a mouth ulcer whenever I'm run down.
Well, ulcers are a really interesting one because there's loads of different things that can cause ulcers that we see in the mouth. And definitely there's also a link between your cycle, so menstrual cycle and so forth. Pregnancy and gums has a huge effect as well because of the hormones, and I'm sure you hear that tale all the time, like my gums got so much worse during pregnancy. But it's just really important that you keep on top of it. And that's why like actually during pregnancy, you should be going in very regularly for cleaning.
So interesting. I think the kind of moral of the story is we need to be going in for cleaning more than we think we do.
Yeah.
Before, we quickly skirted over this topic, but it's actually what I'm really interested in, which is the whole nasal mouth breathing debate. I am definitely someone who breathes through their mouth. I like to run, and if I have a cold, it genuinely makes no difference because I don't breathe through my nose anyway. And I've seen these videos on social media about children who breathe through their nose are more likely to have that like defined jawline versus people who breathe through their mouth are likely to have more of a like less sharp jawline, which I definitely don't have. How much truth is that? Is there any like more serious consequences of mouth breathing? Should we be doing things to try and encourage nasal breathing?
So I am not an expert at this. Orthodontists are good people to speak to. And I also spoke to a breath specialist, and I spoke to my orthodontist about this. There is a orthodontist called John Mew, and I'm sure you've heard about mewing. Did you see all those TikTok videos where you stick your tongue to the roof of your mouth and everyone's like, it makes your jaw look a certain way? Have you seen it?
It's so funny you say that because my best friend from home honestly has the best pout.
Yeah.
Every photo she looks like a supermodel. And I remember once her telling me the trick is to put your tongue to the top of your mouth.
It's called mewing. It's a thing. So John Mew was this guy, an orthodontist, and him and his son, or his son might be John, no, I think it's him. They basically talk about this mewing. So as I said, there's loads of TikTok videos of young people. Yeah, should we do it? Mewing. And basically, but he talks about all of the development and basically how interceptive orthodontics would help a child. Now, there is a debate because a group of orthodontists say there's not enough evidence to show that interceptive orthodontics at a young age will help. And there's a group of people that are now massively into it. And there's a lot of appliances out there that are helping children breathe. I'm really interested in this topic because some people are saying, even parents to me, that like they felt their child couldn't sleep and had symptoms of ADHD, and that was directly correlated to what they now understand as the breathing, and they were given an appliance by a dentist and those symptoms have completely gone away. However, I need to look into it more. What I can tell you is that certainly mouth breathers can have an impact on the way that facial development does form. Typically, mouth breathers have a increased lower anterior face height, so this bit's a bit longer. They have incompetent lips, so I have competent lips if you look at me. Incompetent lips is where somebody tries to put their lips together, but at rest they naturally come apart. You usually see this with the like mentalis, i.e. the muscle here, kind of creasing whilst they try to get that together. So there's definitely, you know, jaw development structure is definitely something that can be affected. And obviously if you're a mouth breather, you're going to lose more water. There was a study that the breath coach told me where you lose like, I think it's like 70% more water than a person that's not a mouth breather. Wow. And obviously, as you know, being dehydrated has a huge impact on your whole body. So I think it's a really interesting part of medicine and dentistry that is going to really propel forwards. And I think that there is scope. And as you know, because I know you're a functional person, although I've been not taught, like, you know, there's not enough evidence at this point, I'm still curious to know what's going to come out of it.
Yeah, absolutely. And in season 1 of the podcast, I interviewed a very well-known immunologist, and she had recently qualified as a breathwork coach. And she was super interested in kind of nasal breathing and manipulating our breath to support your general health, to regulate your nervous system, and also to support your immune system. I haven't read much about it, but I think it's a really interesting area. And it's, again, that overlap between certain behaviours that might benefit more than one aspect of your health.
Yeah.
And we like getting more bang for our buck.
Yeah, exactly.
More bang for our buck is the right saying.
Yeah.
Yes. Interesting. So is there anything else dentistry-wise, health facts you want to talk about? Because if not, I want to move on to you as a person.
I think fluoride is like a big debate for everyone. Should you have fluoride or not? And people are very concerned about fluoride toxicity.
I think in general, people are so interested at the moment at in chemicals
in your body.
You know, not having toxic skincare, people getting really worried about microplastics in food, cartons,
in toothpaste as well.
That doesn't surprise me. But do we need fluoride, or is it another chemical that's unnecessary?
So fluoride, look, the studies are arguably, you know, the overwhelming evidence that fluoride works is there. And the thing is, I think the debate that really should be have is whether you should be having systemic fluoride or topical fluoride. As you know, fluoride in the water is a systemic portal. And I think that there is a bit of an ethical debate because you're not actually making a choice because it's in the water, you know. However, topical fluoride I think is great. And I think it's great for people that don't brush that well and don't eat that well, which is the majority of people. Now, a lot of people will say, I never brushed with fluoride and I don't have any cavities or any problems. And there's some of those people are very rare in the sense that they can spend up to 10 minutes brushing, or they do it really, really well, and their oral hygiene is perfect and their diet is perfect. So yeah, in those circumstances, and what's really exciting, that there's an ingredient out there called hydroxyapatite, which forms the building blocks of enamel, and that's also been shown to help prevent decay. And some people are now saying that we can substitute that for fluoride. So again, I think that I am open. Do I think fluoride damages your third eye and kills you? No, I don't. And I think you have to have a huge amount for that sort of effect on your body. And that's why I think a topical is good, because you spit it out.
Yeah, absolutely. Good to know. So I would love to ask you how you prioritize your own health, because you're obviously a super successful businesswoman. You have a good social life. It's very evident from social media. And you also stay incredibly fit. How do you juggle all of those things and prioritize your own health?
Oh, I love that question. You know what? I think if I'm completely honest with you, is that I go through periods of like burnout and overdoing it. I definitely am like a self-diagnosed ADHD person. My therapist thinks that I'm on the spectrum, which means that like multitasking comes very naturally to me. However, I have learned to prioritize 3 things in my life that's non-negotiables. exercise, sleep, and nutrition. And I know you're like, okay, well, that's so obvious and cliche. My mum's a nutritionist, so I was really lucky that from a young age, I had a lot of knowledge around nutrition. Did have an eating disorder when I was at university, which really skewed my relationship with food. And I was very much on the restriction binge cycle. Now I'm better and I love food, but I also just love healthy food at the same time. If for me, it's balance. Like I literally have chocolate every single day, but I've got to that stage in my life where I can have a little bit every day instead of binging on a whole cake, which used to be my like restriction binge cycle. So that's really, really important to me. Sleep is also just like, if I don't get 8 hours of sleep, I'm awful. And everyone knows that. So like to my partner at like 10 o'clock, I'm like lights out. That's what I want to do. And it was interesting because I saw a reel by somebody, a doctor as well, Dr. Hazel, you know, the food medic. And I saw her say like that she used to try and get less sleep to cram in like meditation and reading or something like that in her morning. But then she got less sleep and it actually made her less effective. And I think in this sort of wellness culture, we're obsessed with trying to do too much in one day. But I'm like, I'm not going to get up early to meditate. I'm just not going to do it because my 8 hours makes me feel better than like half an hour of meditation. You see that half an hour in bed. But what I do is that I get up early enough to go to the gym in the morning, because when I start my day with something difficult, like an ice bath, an exercise, no matter how rough I'm feeling, I know I can tackle the day.
And you know what else about the exercise in the morning?
Yeah.
I think you're similar to me in that your entire day is spent giving your energy to someone else.
Correct.
You know, listening to patients' problems, helping them, chit-chatting away, or showing up for social media or interviews like this. And that time in the morning is not just
sacred.
It is, but it's your me time where you're investing in yourself. And I think not just the physical benefits, but the action of giving yourself that time
100%.
is just a wonderful thing.
And you know what, like, to be honest with you, like, I'm in a privileged position because I often think to myself, when I start a family, how am I going to do it? And I think
the exact same.
I honestly, like, and I think that's like the real difficulty of it. And I feel like mums that look at like those super mums on Instagram and stuff, like it's actually like a toxic, unhealthy culture that we've built, because I know, for example, exhaustion really affects my day if I haven't slept properly. Like I didn't sleep properly on Tuesday night, and between patients I was like putting the chair down because I was just really tired. So I try to make sure those three things are on point. And I think that no matter how ambitious I've been, I've never let it take over my social life, because I'm an extrovert and community is very important to me. So going out and being with people and mingling has always made me happier. I know there's homebodies out there and that's totally fine, but actually if I spend too much time at home, I start to ruminate, get a bit depressed and a little bit anxious, and I start scrolling on my phone, and I'm actually not disciplined enough to like shut off my phone and read a book. Like I've stopped sleeping with the phone in my room now, and I like try to read a couple of pages before bed, which has happened. But I think that that's important. But you have to understand, like, no one can have it all. I could be that level more successful. I could be that level more financially better. I could be that level more. But for me, the balance that I have is like, I like where I'm at. And so I had to give up something, you know, for that.
That's such an incredibly honest experience to share. And I think that's really helpful, because so many people will look at you, same as they will to me, and think, how are they juggling it all? And I'm always really honest with people and think, I have no other responsibilities. Like I can go to the gym if I want to. I don't have any children to look after. It's basically myself. And so we have the beauty of time and autonomy over how we spend our time. And lots of people, even people listening to this podcast who want to live a healthier life, also need to remember that sometimes the people that they're aspiring to be like, their entire life is dedicated to that healthy habit. And it seems like unachievable standards sometimes. So it's great to hear that, you know, you also recognize that you have a unique autonomy with your time.
Like we compare ourselves to like fitness influencers, beauty and fashion influencers, and their full-time job is to do what they're doing. And I think you've got to give yourself grace for the other things in your life. It's really important.
I think it's really important. I think if something that you're doing to be healthy is making you neglect something else, I always think there's like pillars in your life that I want to keep up, which is kind of your health, your work, your hobbies, and your social life. If one of those things has to drop, that's when I don't feel balanced. Like spinning the plates a little bit on each of them is much better for me than doing really well with my job or doing really well with a particular sport. So yeah, I think I'm really similar to you in that sense. Something I'm learning more and more is how important it is to manage our stress levels. definitely noticed as I've got older that the physical and emotional kind of burden of stress takes its toll on me a bit more. I'm not as resilient. And I think that might be because I'm also learning how bad stress and those micro stresses in our day are for our long-term health. How do you manage stress?
To be honest with you, again, it's just totally transparent. I'm still struggling with that. I think there's a massive dysregulation in my body most of the time. And I think that's because we actually live in a very unnatural habitat and environment in the UK. I think the London rat race makes it really, really difficult for you to manage your stress levels. I go to a sound healing class. Great. I can still hear the train, which I just heard now. Do you know what I mean? I can still feel those vibrations. It's totally different from doing it in Costa Rica, when you're with nature and the birds.
Yeah.
So I think we all have these toolkits where now wellness has become such an integral part of our lives. But if we're really honest with ourselves, we are sort of firefighting a lot of the time. And I think for me, managing my stress levels is trying to integrate those little things. I will put a meditation on, an affirmation meditation, 15 minutes, to be you are where you need to be, one of those kind of ones. Go to sound healing classes. As I said, don't overbook myself with work, of course, my productivity is directly related to my financial success. But I took a massive cut in my financial success in the last year or two because I was it's just not worth it.
No.
It's just not worth it because I want to do things like come on podcasts and do my own podcast on, the Thursday and Friday. I want to go get my hair done and get a facial and do all these things. And I have the luxury now of having my own clinic. But I had to make the choice of where I wanted my life to be. So I think it's also saying no to things, saying no to my books being totally full. I don't want to see, I had one patient for the entire day. I just posted her as a very emotional video today. One patient for the entire day, 9 hours. And my nurse said to me, we're probably going to finish her at 4:35. I think we finished her at 5. So we were in the chair with her from 10 till 5 with an hour break in between. But it was so emotionally exhausting. I was why am I going to, I could stick 2 more patients at the end of my day, do you know what I mean? But why am I going to do that? So I think it's also boundaries because I was already exhausted and knowing that my productivity isn't linked to the output, but linked to kind of how physically present I can be with what I'm doing.
I love that. Do you think that attitude has developed over the years?
I'm from a Middle Eastern culture, right? And I know because you went to medical school, you are very aware of Middle Eastern, also Indian, those cultures are very much ingrained, do more, work every minute. My dad, when I was sick at school, I had chicken pox and he still sent me to school because he was this is £500 worth of school day. And I was and they sent me back for being a super spreader. Do you know what I mean? Literally. But that stuck with me. So every time I was ill for work, I had to show up. I had this immense guilt about being ill.
Yeah.
So I think I always felt I had to be working. Even when I worked on the NHS, I did a Saturday private job in my first 3 years because for me, every moment had to be about being productive. And what I realized is having a lie-in and being slow sometimes is actually productive.
Yeah. I really resonate with that. It's so funny. So I had the privilege of being privately educated, but I know that my parents really grafted to be able to afford it.
Yeah, same with mine.
And at times couldn't. They both own their own business and there'd be good months and bad months. And there was definitely conversations about how we're going to pay the school fees.
Yeah.
And I really absorbed that.
Yeah,
and so I felt like I had to really maximize what I got from that education. I really knew how valuable it was. And so I would work as hard as I could all the time. I'd say yes to everything because I didn't want to disappoint them that they were spending all this money they didn't really have. And me not look grateful for it or not make the most of it.
Yeah.
And I think similar to you, I've had to really retrain my brain to think, actually, I've worked that hard so that I don't have to work all the time.
Yeah. And that's the whole thing. And I think my dad finds it almost he's you're not working Thursdays and Fridays. I'm Dad, I don't need to anymore. It's so, because every moment, and I think he really struggles. I think it's probably both our parents' generation with the notion of the entrepreneur mindset where you can, actually true success is where you can be financially comfortable without having to work every single day or be physically present, and that's I'm grateful for our era of entrepreneurs because we can do stuff online, which makes it really difficult for them to understand. They're like, when I introduce my dad, I'm like, yeah, she's like an Instagram influencer. He's like, but how does she make money? I'm like, because she makes money because she does content. He's like, what do you mean content? I'm like, never mind, like it's really difficult for him to like understand that, because those generations, it was about like turning up and showing up physically at pace and putting in the labor work.
Yeah. I mean, I always have to pinch myself that this conversation is work.
Yeah.
Because it's so interesting. When do you ever get to sit down with someone interesting for an hour and have a conversation? Love that. Honestly, I've just checked the clock and I can see that we have talked for nearly an hour. I honestly could talk to you for hours. You're such an inspirational and well-educated, intelligent person. So thank you so much for giving up your time. I have one last question for you, which we ask everyone on this podcast. I would love to know, what is your vision of health? What does health look like to you?
Health to me is about being in alignment mentally and physically, because I don't know if you've read the book, The Body Keeps the Score, but for me, everything, it has a bidirectional relationship. They're linked and it's a symbiosis. So for me, if my mind is healthy, my mental health is healthy, then I can actually keep my physical health healthy. And I think we forget that people can't see mental health, so people don't have empathy with it. I slipped my disc last year and 100% it was linked to my mental state at that time. And people gave me a lot of sympathy for the discs. I couldn't walk, I couldn't sleep, I couldn't work, etc. But it was all because of what was going on in my mind. And I just think my vision of health is when we come to a world where we recognize that we have to give the support to people's mental well-being, and the physical health can follow.
I love that. Thank you so much for coming on Vision of Health, Dr. Rhona. You've been wonderful.
Thank you.
Thank you so much for listening to Vision of Health. I hope you've taken away some practical and realistic health advice that you can implement to improve your lifestyle and get clear on your vision of health. If you've enjoyed this episode, then please do let me know by liking the episode and leaving me a review. If you want to hear more from me, then make sure you're subscribed to the channel. And if you have any friends that could benefit from improving their lifestyle, then make sure you share the episode with them. I'll see you next time.